I have on stage with me Dr. Rochelle Walensky, who previously led the CDC. Obviously, you led the agency at what may have been its most visible point. The work is always important, but during the pandemic, I feel like we all were watching you on TV all the time. But for people in the audience that maybe aren't following along as closely with what's happening this year, can you describe what the state of the CDC has been the past 11 months?
Yeah, first of all, thank you for the opportunity to be here. It's a pleasure to be with you all. The CDC's mission is to protect the health, safety, and security of America and people around the world, Americans and people around the world. And while I think prior to 2020, if you asked most Americans what CDC was, they might not even be able to tell you what the acronym stood for. So we came into the limelight, I think, during the COVID pandemic, and people sort of anticipated that that was what CDC did, is they sort of dealt with pandemics when they happened. But it is the case that CDC does way more than that, and on the infectious disease side, for sure, whether it's a foodborne outbreak, which might have been another time that you hear about from CDC, you know, don't eat the lettuce because there's a listeria in the lettuce or things like that, but also things that sort of help in public health, clean water, clean air, cancer and hypertension and tobacco cessation and all of those things, and then a lot of work in preventing infectious diseases and outbreak investigations and those sorts of things. What's happened over the last year, which is really just devastating for me to watch, is not only the amount of money that has been cut and that is proposed to be cut, but the loss of both personnel and extraordinary expertise that the agency is sort of built on. Now, I'll be the first to say that our federal agencies are imperfect. I learned that while I was there, and there was a lot of work that we did while I was there to improve some of the things that I saw while I was there. But it is also the case that they are filled with extraordinary subject matter experts who, when you have an outbreak, as we did during my time at CDC on Mpox, that we actually had expertise on Mpox. We had a budget on Mpox. We had people who had been to Mpox endemic areas, had done investigations, understood the diagnostic tests and the treatments for them. And it is that essential expertise that occurs in a wide swath of areas at CDC that is now being lost.
Right. And it's not just the federal agencies that have been disrupted. You have spent most of your career outside of the CDC at Harvard, and obviously there's been immense pressure on universities through research dollars, through federal changes. Like, what has that meant for our ability to respond to public health threats as they may arise?
So it's both the subject matter expertise that is happening at the CDC. I also want to acknowledge that most of the CDC budget does not stay at the CDC. About 70% of the CDC budget, certainly while I was there, goes out to state and local public health officials. And if you look at the states across the board, about 50 to 70% of those states' budgets come from CDC. So the fact that CDC's budget is being cut really does affect what's happening locally. Now you partner that with what's happening at NIH and the uncertainty both at NIH as well as the sort of pipeline of what's going to happen in science, whether that is funding to direct scientific labs, whether that is training programs, whether that is indirect costs, which fund the scientific enterprise really at our universities, whether that is the inability to have foreign nationals come in and do that training, and then the sort of diminishing of PhD programs and how many slots are going to be available. It really does weaken the whole foundation of both what our science and future science and innovation is based upon, as well as our ability to tackle public health threats.
Right. And I think a perfect example from this year of what the changes to the CDC have meant has been the measles outbreak. It has been the largest outbreak since we declared elimination in 2000. There's been, to date, 1,723 cases across the country. 2 weeks ago, Canada lost its status in elimination, and some reporting this week suggests that we may be trending towards that direction. Can you sort of tell us, like, what has been the state of this outbreak this year?
Yeah, so what people generally talk about with measles is you need to have about 95% population protection to have what's called this herd immunity that so many people have been talking about. The challenge is that it's not just that your state has to be 95% protected, it's like you really locally have to be 95% protected. And so, there's an outbreak currently ongoing, over 50 cases in a South Carolina school. That school, I don't know what the state coverage is in South Carolina, but that school is 17% vaccinated. That will lead to an outbreak for sure. So what is happening is especially when you have an imported case. What is happening now is we're getting these bursts of outbreaks that are happening because local protection is not over 75%. We heard about the Texas outbreak that happened earlier this year. There's an ongoing outbreak in Arizona and Utah, and then this South Carolina outbreak that is ongoing. And that has led to over 1,700 cases, the largest number of cases that we've had in over 30 years, and certainly since we were declared eliminated earlier, several decades ago. The issue with the loss of elimination status is that we actually have to demonstrate that it's not just imported cases that are resulting in a local outbreak, but the outbreak in Texas is somehow linked to the outbreak in Arizona, and that there has been ongoing transmission of these linked outbreaks for a year. That is what just happened in Canada. What was unclear and remains unclear is whether that Texas outbreak that happened earlier this year is actually linked to the Arizona and Utah outbreak or linked to the South Carolina outbreak, which would imply this ongoing transmission. Until yesterday, when there was a report that actually said, they are genetically linked. The Texas outbreak and the Arizona outbreak are genetically linked. So more to come on that. That is like early data, but it doesn't bode well that we have had more cases than we've ever had in several decades, and that their earliest indication is that they may be genetically linked.
Right. And obviously the situation has been pretty dire, especially compared to recent history, but is it mostly a semantic difference that, if we lose this elimination status, or like what does that mean to you if in January when this goes to a vote, we lose the status?
I think it is certainly a sad state of where we are in public health. When people ask me if we are ready for the next pandemic, among my responses is we are now fighting yesterday's pandemics, right? Like we can't even be looking forward. We're now actually looking back and trying to work on things that we had already tackled and conquered. It also is an indication of, measles is just one of those things, one of many diseases that we vaccinate for. While I was at CDC, we had our first case in this country of paralytic polio than we had in over a decade. We have seen other outbreaks that are ongoing. I just this morning actually saw the Commissioner of Health here in Massachusetts, and he tells me that our COVID vaccination rates are down by 30%. Our flu vaccination rates are down by 10 to 15% compared to this time next year. So it is a marker of lack of protection in the population, not just for measles, but for all the other things that we have relied on protection for.
Right. Let's talk more about vaccines. Obviously, Robert F. Kennedy Jr., who's now health secretary, long before he took that post, has been a skeptic of vaccines, and during his tenure has sort of picked apart at the infrastructure of this country and how we vaccinate children. I guess, what are the 2 or 3 things that really concern you the most?
So among the things that there's been erosion of vaccine confidence. We have seen that. We can see that by the vaccine rates. There's an intentional confusion. And when people say there's confusion, it's the things that our societies and our government were once unified in saying about vaccines and their importance in protecting yourself and your loved ones are now, they've diverted and in fact, or diverged, I should say, and our societies and medical institutions are really speaking with one songbook, and our US government is now speaking with another. So I've actually been working for the last several months with a group called the Vaccine Integrity Project, where we are actually reviewing the science that used to be reviewed by the CDC, but is no longer being done. We just completed a review of the respiratory virus season that was published in the New England Journal of Medicine, looking at the data on COVID, RSV, and influenza to say, The CDC did not present these data to you this year, but we want you to know all of the data that are out there that demonstrate the safety and effectiveness and ability to co-administer these vaccines. So that is available outside the paywall so that people have access to those data. Actively right now, we anticipate, and we've seen through the ACIP, that the hepatitis B vaccine is on deck, and so we're actually now doing that scientific review to say what is the data to inform why we deliver a neonatal birth dose to children for hepatitis B. So sort of simply the data and access to the data, I think, is a really important thing that CDC and the ACIP used to do for us. There are two other things that I think are not as transparent. One is the Vaccines for Children's program. So you've heard a lot about discussions about the vaccine schedule and whether they will change the vaccine schedule. The reason that the vaccine schedule is important is because it informs the policy of the Vaccines for Children's program. And this is a program that delivers vaccines free of charge to our children who are under and uninsured. And the reason that that is so important is because we need population protection whether or not those children have insurance. And it is that program that I think is at risk based on the schedule. One final thing in that is the Vaccine Injury Compensation Program. We acknowledge that there are true, albeit rare, injuries associated with vaccines. And when they are adjudicated, those people should merit some compensation for those injuries. In order to keep both physicians and our manufacturers free of responsibility from that for those very rare injuries, there is this program that compensates people for them, and that program is at risk right now. And in the absence of that program, we may see manufacturers, we've seen it before, choose not to make vaccines.
Right. As you alluded to, hepatitis B sort of seems like the next frontier of this back and forth. Just a couple of weeks ago, President Trump said there's no reason to give a baby a hepatitis B dose, that he would just wait until the baby is 12. Rand Paul sort of doubled down on that as a physician and also a U.S. senator. He was sort of pushed back on that by Bill Cassidy. Like, why has hepatitis B become this like political flashpoint that all of these different people are weighing in on?
I think it's a somewhat easy target. You have a neonate, a just-born infant, and the universal, here's what I will say, is that in the absence of neonatal dosing for this vaccine, we saw dozens, if not hundreds of cases of babies who were born with acute hepatitis B and the long-term manifestations of hepatocellular carcinoma or cirrhosis associated with that, if not acute death from the acute infection itself. Many people who carry hepatitis B do not know they have it. And while we have these systems that certainly there's access to care and hepatitis B screening, but that falls through the cracks. And in the absence of the neonatal dose, we saw infants who were infected, and with this neonatal dose, we are down to 1 or 2 cases per year. So they are going after it. It's a vulnerable period of time, certainly in neonate, a newly delivered baby, a new mom. Like, that's a very fragile, vulnerable time, and I feel like that feels like a good time to potentially try to meddle in that access.
Right, and on December 5th, the CDC's committee, who advises them on the vaccines, called ACIP, will dedicate basically an entire day to talking about the evidence. As you said, the Vaccine Integrity Project is in parallel doing its own evidence analysis. Like, what does that look like?
So first of all, I haven't looked like in the last 24 hours, but on the Advisory Committee on Immunization Practices, the ACIP website, there is a schedule that looks like much of the day is going to be dedicated to hepatitis B. We don't have all of the details of what that discussion will be, and so but we do know that from the prior meeting, there was a lot of discussion about this neonatal dose. So what the Vaccine Integrity Project really wanted to do was, with a very objective, none of the the group reviewing this science, everybody has put their disclosures forward. Nobody has industry funding. With a very objective, very scientific point of view, review the evidence and say, let's understand what was the background. How did we get here? What's the historical perspective? Why is there a need to do this right now? What are all the safety data that led us to this space? What are all the effectiveness data? What are the clinical trials? And really a comprehensive review to say, how did we get here? And is there now a good rationale to revisit this question? If we did, what are the implications of revisiting that dose?
What is this like for physicians? Because now you have sort of in 1 year, the CDC saying to do X, Y, or Z, and now you have the Vaccine Integrity Project, you have professional societies who at times are at odds with the CDC. Like, what is that like for physicians on the ground who are debating vaccinating children? What does it mean for parents?
Yeah, I think the real issue is, for the most part, I'm pleased to say that our societies, the Vaccine Integrity Project, other groups who are doing this kind of work are generally singing from the same songbook. They are generally, hospital associations, even insurers, are frequently saying, like, we understand where the science is, we understand how we got here, we want to continue. The thing that is divergent is what the recommendations are that are coming out of the federal government, the ACIP, the way ACIP operates with regard to reviewing the data even are different. The working groups and how those data are presented. There was a very strict evidence to recommendations framework that was sort of rinse and repeat at every ACIP meeting so that we were familiar with the kind of data and how it would be presented. That is happening less and less now. And so I think it's a difficult spot for a parent who doesn't know where to get their information from. And my general advice is to get it from your trusted healthcare professional.
Right. We have a question from the audience. Someone is asking, beyond risks and deaths associated with vaccine preventable diseases, what keeps you up at night with regards to the CDC and the changes we are seeing there?
So beyond vaccines, I will say among the things that worries me is influenza. So in January, the United States is set to withdraw from the WHO. That is critically important. So CDC is one of those places that gets thousands of influenza samples every year from around the world to understand what kinds of virus is circulating and to understand what we need in our next influenza vaccine. We are now not receiving nearly as many of those samples. One number I heard, although again I'm not there, is that we're down about 60% of samples that we normally get. So as you're trying to understand the virus that is circulating, the risk that you will have, and what you need in your vaccine, we're losing our line of sight, and we are set to lose more of it as we withdraw from the WHO. The things that worry me are, in addition to that, are the expertise that we've lost, sort of how we've started. What are the core capabilities that we no longer have with regard to, we had a train derailment while I was at CDC. Do we have the environmental expertise we used to have? We had this Mpox outbreak. Do we have the exotic, disease expertise that we used to have? And these people are like extraordinarily trained in a very, very specified way, but those outbreaks do happen. And then really, are we getting the menu of all the information that we need from our public health experts from around the country? And is that being now articulated so that if there is a risk in one county that might be reported to the CDC and next door is a neighboring county who is similarly at risk, are we getting that communication so that CDC can be in the loop and those announcements can go out?
Right. We only have a couple of minutes left, and I see a question here about communication and trust. And I guess I wonder, what do you see as the path forward, right? It does seem like there are two sort of very divided camps, with the people that are currently in charge of the administration on one side and much of the scientific community on the other. How do you start to bridge that divide?
I think now is a particularly hard time to bridge that divide. I think the current folks with the megaphone, within the U.S. government who are sending those messages, are trying have succeeded in eroding confidence, certainly in vaccines and other spaces. I do want to just articulate that there's discussion about gold standard science, about transparency, about honesty, I believe, and about making America healthy. I believe in all of those things. The Vaccine Integrity Project, among the things that we did from a transparency standpoint is we put all of the papers out there that we reviewed. They're available on our website. You can click any single one of them. There are 511 of them. We want you to see it. So I believe in the words that are being said. I want a healthy America. I want gold standard science, and I want the transparency to get there. And I just, I have issue with how that is currently happening and how that is being communicated.
Right. And I wonder, you stood up the Vaccine Integrity Project earlier this year because of what you were seeing at the federal level. What is your signal that we've eclipsed this, that maybe there isn't a need for the Vaccine Integrity Project anymore?
Yeah, it's a great question, because I will say that our goal in the Vaccine Integrity Project is to layer this bridge. There are many things in VIP that we cannot do. The vaccine adverse event reporting system runs out of the CDC. We don't have access to it, right? So there are many things that we cannot do from the outside of government. And our goal now is to really just foster and serve as that bridge until what I will call a time when that bridge no longer needs to be made. And we are really hopeful. We're actually having discussions now. When we set Vaccine Integrity Project up, among the things we said is, how would we know when we need to take action? And as we were having those conversations, all of the advisory committee on immunization practices was fired. And we said, this is probably the time. So I think we will start to really understand when we have scientific experts who are immunologists and pediatricians and immunocompromised specialists who are rerunning the vaccine integrity, who are running the advisory committee on immunization practices again, when the data that are being used to make vaccine recommendations are published data, or those data can be vetted, when they are not sort of white papers that are being, flashed around. Those are the kinds of things I think that we are looking for.
Right. And for the final question from the audience, if you could give one piece of advice to this administration and have them hear it out, what would it be?
Wow. It's mostly to listen and collaborate. I did a lot of work while I was at CDC, talking to folks behind the scenes, saying, I may not be your golden messenger. I don't need to be your golden messengers. Let me help you so that you can be the messenger, and I can give you all the resources that you need, the good, the bad, and the ugly, so that we can actually speak with one voice. Ultimately, while I was at CDC, the goal is to make everybody healthy. And I don't actually care where you live or where you're from. I want you to be healthy. And there's science behind doing that. And so it's to sort of open the doors to more communication, and because I think some of those communication lines have been lost.
Right. It's a perfect place to end it. Dr. Walensky, thank you so much for being here with us.
Thanks for having me.